Welcome to our series about being age-friendly in daily care. This series of short training programs is intended to help build skills among direct caregivers employed in nursing homes and other long-term care settings. The age-friendly movement hopes to influence how care is delivered in a variety of care settings, from hospitals to nursing homes. Certified nursing assistants and other daily caregivers are truly the backbone of nursing home care. Your understanding and use of age-friendly approaches is essential to advancing person-centered care that improves quality of life for older people. Improving your age-friendly skills helps you know the person as a human being who has often lived a long and full life. Getting to know the person helps you understand things from their perspective and communicates that you respect and care about them. When they feel safe and supported, risks of frustration and stress are reduced for them and you. Of importance, the motto of this training program is, "What is good for the resident is also good for daily caregivers." Residents are unlikely to get high-quality care if the person caring for them, you, the daily caregiver, is stressed, burdened, and feeling frustrated throughout the day. Age-friendly care starts with what matters to the older person, and then looks at how medication, mobility, and mentation may overlap and interfere with doing what is important, or how they may support doing what matters most. The framework is a big shift away from the medical model that focuses on illness and disease treatment. Instead, it emphasizes being person-centered, thinking about the person first, including their lifelong characteristics, abilities, values, and preferences. What matters most to older adults is often a three-part question that includes life and living, related to values and beliefs that direct daily living. What gives the person joy, happiness, and meaning in daily life? Values and beliefs about life and living overlap with both health and healthcare, which are different things. Health includes all the person's health-related conditions and concerns, medical or mental health issues, functional challenges, or changes related to aging like vision and hearing. Healthcare is the treatment provided for medical problems, diseases, or conditions the person has. The age-friendly framework starts with questions about life and living, and how those values and preferences influence what matters most to their health and healthcare. There is a lot to know about individual residents, and being person-centered means each person will have values and beliefs about life and living that are unique to them. In turn, daily caregivers can greatly improve care by asking some simple questions about what is important to the person. The goal is to get to know the person and what they prefer or value about the care you and the other team members provide. In getting to know the person and working to do things that matter to them, you build a relationship that also improves the quality of your work life. The point is that daily caregivers make a big difference in the quality of care that older adults receive. You spend more time with residents than any other team member, so use that time to talk to the person. Instead of working in silence or just giving direction about the person's care, have a conversation. Ask the person about their life, the pictures you see in their room, or personal possessions that may have a story. Use the questions we suggest to find out what is enjoyable to or what helps their care be more enjoyable. The information you gather helps you better understand the person and follow their care preferences and helps them do what is enjoyable or important. The focus on what matters in daily care and activities may be different than what matters related to the person's health issues. Your role may not extend to treatment decisions that are guided by what matters most to the person, such as medication use or mobility preferences. However, there are lots of choices and preferences for what matters that you directly control or influence. Asking residents about what might make this a good day is a good practice, as priorities may change over time. The important role of daily caregivers can't be emphasized enough. You are the backbone of nursing home care and make or break person-centered care in your setting. It's really up to you to know the resident and what matters most, and then follow that in providing person-centered and enjoyable activities. The contributions you make are not just beneficial to the resident. Shifting your focus from completing tasks, just getting the job done, to talking about what matters as you provide care helps you know the person. In turn, risks of distress are often reduced for both you and the resident. In short, being person-centered and doing what matters also benefit you. Your positive engagement with older adult residents helps establish a shared understanding of what matters to each person. By sharing information about what you learn, you and your team can tie what is important to the person to their preferences for their daily care and activities. You can also use the information to motivate the person by using their own goals. For example, Mrs. Smith said it's important to attend church services on Sunday, but is resisting taking her shower. Remind her that Sunday is around the corner and she will want to feel fresh. That may help. The other important issue here is that your engagement with residents, your observing and asking questions and sharing information, helps you become a valued and respected member of the care team. In summary, your conversations about what matters in daily care and activities can make a big difference in quality of life for residents, but also in the quality of your work life. Understanding what matters relies on your ongoing conversations with residents to best assure changing priorities are understood and daily care routines and activities are adjusted. Sharing information with team members and using the residents' own goals for daily care communicates respect and care for the person. In the next session, we'll talk more about the importance of communication.